respected chairpersons, moderator, teachers, colleagues and friends. I thank the organizers of IPDI to giving me the opportunity to present here in this delicate gathering. Today my topic is on cutting, scoring and OPN balloon. These three balloons are already shown by Professor Ashok Sher sir. These are the specialty balloons called specialty balloons, and by this using of the balloon, the outcome of PCI at this stage is almost improved. Now the cutting balloon has 3 or 4 sharp metal microtomes blade, which are known as atherotome, mount over a non-compliant balloon which incises the score, the coronary atheroma during coronary inflation. These are the pictures showing this is a sharp tip non-compliant nylon balloon material and the radio-opaque marker in its proximal part. The commonest indications are instant restenosis, aortosteal lesion in case of saphenous venous graft, focal saphenous venous graft stenosis, which are more fibrosis, and resistant fibrotic lesions are the classical indication of doing and cutting balloon, but it should be in absence of visible thrombus in angiography. The equipments in case of cutting balloon, 6 French is, you can do a 6 French guiding catheter and a cutting balloon size less than 3.25 millimeter or less. But if we use a 3.5 above and with 4 atherotomes, then the guiding catheter must be of 7 French. Sizing of the cutting balloon is very much important in this procedure. It should be a balloon to artery ratio of 1:1. Measuring from the media to media by IVAS. And in case of instant restenosis, this can be oversized by 0.025 millimeter or 0.05 millimeter. Now the inflation and deflation of the cutting balloon has a special characteristics. Inflation should be done very slowly as there is atherotome inside. It should be inflated with 1 atmosphere in every 5 seconds, and after the full nominal pressure, this should be an inflation time of 60 to 90 seconds. Deflation should be done very slowly and dialing down on the in deflator and then negative it. In case of bifurcating lesion, cutting balloon should be dilated in most disease segment first, and the cutting balloon size should be separate and appropriately in both the vessels. And kissing should not be done with a cutting balloon. In case of ISR or aortosteal lesion, cutting balloon may be hung up into the aorta using a 15 millimeter cutting balloon or longer. The contraindications of cutting balloons are do not cross it over a previously deployed stent. As this cutting balloon are deployed, the balloon may be entangled into the stent and it difficult to be withdrawn. Avoid in lesion with thrombus. This is a case where cutting balloon is used. You can see this is anomalous RCA, have a calcified lesion in this proximal part. Wiring done and cutting balloon done with the 2.5 NC cutting balloon at 12 atmosphere and the 3 into 21 millimeter dash deployed. And this is the final result. Now the scoring balloon consists of a double lumen catheter which is a non-compliant over a non-compliant of a semi-compliant balloon surrounded by a external helical scoring edge. There are commonly 2 wires, normally nitinol wire or a conventional guide wire is used in this part. Indications of scoring balloon are calcified and fibrotic lesion. Calcification is mild to moderate, not severe calcification cannot be done. Osteal lesion, bifurcating lesion, long diffuse lesion. In instant restenosis, scoring balloon is very important. And in vessel preparation after atherectomy or prior stenting. If you are doing a rota, then we can do a scoring balloon also. The special consideration in scoring balloons are as geometrical distribution of the helical scoring, the device had good flexibility and trackability to make the device in a calcified vessel. In a difference from a cutting balloon is that it is less non-compliant. So at high pressure, its diameter tends to increase. And in case of cutting balloon, the difference from scoring balloon is that it tends to be more challenging. Cutting balloon are more probability to deliver than scoring balloon. So scoring balloon may be important. This is a octogenarian which has a calcified lesion in distal left main and proximal LAD and LCX. Dilatation done to left main to LAD and LCX with 2.5 10 millimeter NC scoring balloon. And after pre-dilatation of the scoring balloon, this shows it is, I think that it was undersized. Then I took a 3 into 10 millimeter NC scoring balloon and dilated the LAD ostium from the left main. And I have stented with the left main with the tap technique. And this is the stent base of the patient. The OPN balloon is a high pressure balloon. It is also known as very high pressure balloon. The OPN balloon is a double layer balloon with minimal dog boning effect and an optimal resistance to deformation, with guarantees a preserved balloon diameter even at higher inflation rate. The balloon may be inflated up to 35 atmosphere, even up to 40, with minimal risk of balloon rupture. Characteristics: twin layer balloon construction with virtually zero dog boning effect. Super high PTCA balloon of 35 atmosphere, long tapered tip with good crossability, and minimum guide wire is 6 French. Indications of the OPN balloons are already mentioned by a previous speaker. A high calcified lesion, undilated lesion, combination with a rotablation, in situ, and in case of replacing cutting and scoring balloon. And this is the economical solution of a complex PCI. How should this OPN balloon should be used? OPN balloon should be sized in instant restenosis of less than 0.5 than the basal diameter. It should be inflated up to 20 atmosphere normally, and after 20 atmosphere with 5 atmosphere it should given 10 to 20 seconds of time. Special consideration of OPN balloon in under expansion is that under expansion balloon, the OPN balloon is very much important. Underlying circumferential calcium with OPN balloon in an undersized stand can be corrected. In case of calcified lesion, OPN balloon is an excellent for the presence of severe calcification with concentric plug and extended arc of calcification. This is a 75 years old man with calcified lesion in the severe calcified lesion in the left main and proximal LAD. First of all, we tried with the NC balloon. This does not crack the calcium. Then an OPN balloon taken, pre-dilated lesion went up to 35 atmosphere. Then after dilated with the OPN balloon, this looks like this. And we stented the lesion with 2 stents, left main to LAD and the LAD. This is the final result. And this is the estimated performance of each specialty balloon according to the specific anatomic stress. In calcified lesion, all the 3 balloons can be used. But if there is calcium nodules is there, then OPN balloon or high pressure balloon cannot be used because it is more chance of developing perforation of the vessel. And in fibrotic lesion, classically cutting balloon should be used. Instead, under expansion, classical is of OPN balloon, and in instant restenosis, cutting and scoring balloon is of importance. So I highly acknowledge Professor Fazila Malik Madam, my mentor, in helping me this preparation of this case. In conclusion, use of cutting, scoring and OPN balloon have dramatically changed the modern approach to operators in angioplasty. The use of cutting, scoring and OPN balloon can result in better PCI outcomes in selected cases, especially in combination with intravascular imaging. In fibrotic lesion, cutting balloons are more favorable for the lesion preparation. In stent under expansion, OPN with a very high pressure balloon is the choice. The design of the scoring balloon favors a control and uniform balloon inflation that minimizes the risk of balloon slippage. Thank you all for patient sharing.
I have a very simple question to Dhiman Banik. Actually, have you any experience of reuse of scoring or cutting balloon? Yes, because these are the very costly equipments.
Yes, in our hospital, we have scoring and cutting balloon available in our clinical practice, in our interventional practice. Scoring balloon is important in this case. We use more scoring balloon as the balloon is cost less here, and we can use it in one balloon can be used in many patients. Many means 4 to 5 patients. But cutting balloon, as there is atherotomes inside, it is more costly than a scoring balloon, almost double in our country. And it cannot be used in the second or third case. And in OPN balloon in our hospital, we have used twice in an workshop only, and not available here because it is very costly, almost more than 1 lakh Bangladesh taka per balloon, and it cannot be used in more than one patient with one balloon.
Thank you, sir.